Today, we're going to talk about wound healing myths, and I'm going to bust them. Okay, we're going to be talking about why is it bad to let a wound breathe, all right? We're going to talk about alcohol and hydrogen peroxide and why those, traditionally were recommended for cleaning wounds, but it is a bad idea. I'm going to talk about scabs. Are scabs good or bad, and should you remove them? We're going to be talking about antibiotic healing ointments, scarring, and then swimming with a wound. Is that a bad thing or a good thing? And what's the myth? All right, let's get into it. Wound healing myths busted. Let's go. Welcome back to Citizen Surgeon. My name is Dr. Eric Pearson. I'm a surgeon, and today we're talking about wound healing myths, and I am going to bust them, all right? And so there are a ton of myths associated with wound healing. Now, I've done a bunch of videos on wound healing. I'm going to mention those throughout today. And if you need some more information, I'm going to direct you in, so definitely watch those videos. But let's get right into it. What is the first myth? Well, the first myth, and I hear this all the time, is, well, you gotta let a wound breathe. Let a wound breathe. You hear it, dry that wound out. Well, that is a myth, and that is a bad idea. We do not want wounds to be in a dry environment. We want wounds to heal in a moist environment, and I'm going to give you 9 reasons for that, okay? So first is cellular migration and proliferation. So in the first wound healing video that I did, Wound Healing 101, I talked about the stages of wound healing and all the cells involved. So we need keratinocytes, we need fibroblasts to lay down collagen, and that doesn't happen in a dry wound bed. So we need a moist environment for cellular migration and cellular proliferation. The second reason is growth factors and cytokines involved in healing. I talked about these as well. So transforming growth factor beta, there are a lot of different cytokines. And if we have a dry wound bed, we're not going to get efficient production of those cytokines to promote wound healing. Third is that a dry wound bed leads to cellular death, and we don't have an environment that promotes cellular growth. So if we have dehydration or drying out of a wound, we're going to get cellular death at the wound edges, all right? And that is where wound healing is occurring. That re-epithelialization of the wound is happening at the wound edges. And if they are dry, if that wound is breathing and drying out and dehydrated, those keratinocytes, those fibroblasts are going to die. All right. Also, things like macrophages and neutrophils in the early inflammatory part of wound healing are going to be impaired as well. So that's the third reason letting a wound breathe is a bad idea. What's the fourth reason? Now, the fourth reason, and we're going to talk about scabs a little later, but when you have a dry wound, you're going to get a scab or you're going to get an eschar. And what is that? That's built up dead cells and debris. And what can a scab or an eschar do? That can trap bacteria and other dead tissues, foreign body that you don't want in the wound, trap it in the wound. So when we dry out a wound, we're more likely to get a scab, and that is a bad thing for wound healing. A fifth reason that drying out and letting it breathe is a bad idea is we get a massive imbalance in our wound healing. So if we want an optimal balance to get through all of the stages with wound healing, we need to create a moist environment. So for example, if we have a dry environment, we've let that wound breathe, we're going to have more irritation of the wound. We're going to have more trauma to that wound. That wound is not protected. We're going to have more bacteria entering the wound, and that all impairs wound healing. So a fifth reason that letting a wound breathe is a bad idea. You want a few more? I'm going to give you a few more. Let's get to a sixth reason. Well, a sixth reason is if we have trauma to the wound and increased irritation to the wound and more bacteria getting into a wound, that wound is going to hurt. And so if we keep a wound protected and we keep a moist environment, we have reduced trauma and we're going to have reduced pain and reduced inflammation. So that sixth reason is letting a wound breathe hurts. Okay, so we want to avoid that. A seventh reason, and this gets back to number one, which is cellular proliferation, is that we get faster re-epithelialization of the wound if we keep it protected in a moist environment. So that wound healing is occurring from the edges, and we are going to get re-epithelialization of that wound with the keratinocytes and the fibroblasts laying down collagen if we keep it in a moist environment. Well, the next reason, number 8, is reduced risk of infection. So if we protect a wound in a moist environment, we're going to have a healthy balance of cells, okay? So we're going to have macrophages that are going to be removing bacteria, debris, foreign body from the wound. We're also going to have fibroblasts laying down collagen and reduced incidence of infection. So if we let the wound breathe, we have more trauma, more bacteria, and a higher risk of infection. So that 8th reason is to reduce the risk of infection. And number 9, for many of you, this might be the most important one. I gotta say it, it's reduced scar formation. So when we have scabs and we have eschars and we have repeated trauma to a wound, we have much higher likelihood of having a scar. So keeping a moist environment, keeping that wound protected until it's fully healed, reduces in a much improved scar. So those are 9 reasons why letting a wound breathe is a myth, and it is generally a bad idea. Now, I gotta say that if you have a wound, don't take my word for it. You gotta see a healthcare professional. Make sure you see your doctor, your PA, nurse practitioner, whoever is guiding your healthcare if there is something you're worried about, okay? So let's get on to the second myth. Well, what is the second myth? The second myth is about alcohol and hydrogen peroxide, and this idea that you need to clean the wound with alcohol and hydrogen peroxide. And that is an old wives' tale. That is not true. That is a total myth, and I'm going to tell you why. So alcohol and hydrogen peroxide are commonly used disinfectants. I do have both in my house. Hydrogen peroxide I use for cleaning shoes, but that is about it. I definitely don't want to use it in wounds. And why is that? Well, both of these are massive irritants and they cause cellular death. Now, do we want cellular death when we're doing wound healing? No. We want cellular proliferation. Of course, the right cells, but alcohol and hydrogen peroxide, it doesn't select which cells to kill, so it kills everything. And that can cause significant wound irritation and impaired wound healing. There are plenty of studies that have shown that even at low concentrations, hydrogen peroxide can cause oxidative damage to both keratinocytes and fibroblasts and impair their ability to heal the wound. So traditionally we thought, well, if we have a very clean wound bed and we disinfect that wound, we're going to have improved wound healing. We get the hydrogen peroxide, it foams, that is a really good sign. But instead, now we know, since wound healing is a very complex process, we know that it actually damages the wound bed and impairs wound healing. What are some of the ways it does that? Well, it can disrupt growth factors and cytokines. So platelet-derived growth factor, PDGF, or transforming growth factor beta, those are crucial for wound healing, and alcohol and hydrogen peroxides can denature those proteins, make them ineffective. Both of these disinfectants can increase inflammation and increase the risk of scarring. If we have increased inflammation in wound bed, fibroblasts may be laying down collagen in a disorganized pattern, and that can lead to worse scarring. Hydrogen peroxide itself can cause increased oxidative stress, and that can be very impairing of both fibroblasts and keratinocytes when we're laying down new cells. Alcohol dehydrates things. So alcohol is going to cause that wound to dry out. We just talked about all the reasons why a dry wound bed impairs wound healing. And finally, hydrogen peroxide or alcohol just lacks effective debridement. So while you think that foam is doing something, it's actually not even as good as using sterile water or sterile saline to gently debride and irrigate a wound. So alcohol and hydrogen peroxide to clean a wound is a complete myth. I hope I've given you enough evidence to believe that. All right, let's get on to number 3. What is the third myth? Well, the third myth that I want to talk about is scabs are good. Scabs are a sign of excellent wound healing. That is a myth. I'm sorry to say, scabs are not good. Scabs, as we talked about, are signs of a dried out wound. Built up eschar and dead skin cells is not good for wound healing. And let's dive into that just a little bit more. So what are scabs? Scabs happen when blood and wound exudate hardens, dries out, and forms over the wound. Well, what is one reason that scabs are not good? Scabs are bad. Well, they create a physical barrier to healing cells to repair that wound. So a physical barrier to keratinocytes and fibroblasts entering that wound at the edges and trying to get that to heal by laying down new collagen and re-epithelializing the wound. Now, if we don't have the free movement of keratinocytes and fibroblasts, then wound healing is going to be impaired and delayed. So we want to avoid scabs because of this physical barrier it creates. Next, the scab is essentially a dry environment. Okay, so it's dried out blood, dried out exudate, creates that physical barrier, and it prevents autolytic debridement by healing cells such as neutrophils and macrophages. Another reason, and I sort of touched on this, is that scabs can promote prolonged inflammation. So if a scab is built up debris, built up dead tissue, even built up bacteria, that is going to cause increased cytokines that we don't want. So interleukin 1, interleukin 6, TNF alpha, and those are pro-inflammatory and they are going to impair the wound healing process. Another reason scars are bad is that it impairs the development of granulation tissue. So granulation tissue is basically new blood vessels. This is angiogenesis that is providing blood and getting those fibroblasts into the wound. And if we have a scab, we're going to prevent that granulation tissue from forming. Finally, scabs can worsen scarring, as we talked about, and also increases the risk of wound disruption. So if we have a scab and then we have trauma and that scab breaks open, then now we're introducing new bacteria into the wound and increased trauma to the wound, which is going to impair wound healing. So how do we prevent scabs? Well, we prevent scabs by maintaining a moist environment. And there are a bunch of different dressings that you can use. And I'm going to show a couple of those here. So we can just use Band-Aids. Another one is Mepilex. So a nice silicone foam dressing can stay on a wound for up to 7 days. It can also manage the exudate. And if you haven't seen my video on the wound dressings and sort of all the different types of dressings, I would definitely recommend checking that out. We can also use a transparent film dressing. And in the next myth, I'm going to actually talk about, well, what dressing can you use if you have a scab? And what do you do if you have a scab? And that brings me to the next myth. And what is the next myth? The next myth is that removing a scab is a good idea. Well, let's bust that, because removing a scab is a bad idea, all right? We don't want to pick that scab off because now we're introducing bacteria, we're traumatizing the wound, we're going to impair that wound bed. But what do we do if we get a scab? What do we do if we listened and we said we're going to let that wound breathe, and now we have built up blood, exudate, eschar, dead skin cells, a dry scab? What should we do? What do you think? Well, I'm going to tell you. So if we have that, that is a sign that we have a dry wound bed and we need to rehydrate the wound. Now we can do that with some specific dressings, and the ones here I would say would be your hydrogel dressings. So hydrogel dressings are excellent in superficial burns. They're great in abrasions. They're also good if we have scabs, and that's going to rehydrate that wound bed and allow the body to do its autolytic debridement with the cells in the body, moisturize that wound bed, and get it in a positive healing direction. Also, if we have a scab and we have this dressing before that, we want to keep the area clean and moisturized, gently irrigating and gently debriding the wound. That just could mean just rubbing the wound gently with clean, soapy water and rinsing that clean and then applying a moisturizing dressing. Another thing that can help is applying a moisturizing ointment like a petroleum jelly that will also protect the wound and allow it to maintain its moisture. That moisturizing ointment is going to prevent tearing, prevent cracking, and reduce the trauma to the wound and sort of rehydrate that wound so we can get optimal healing. Now, in all wounds, and especially if we have a scab on there, we want to monitor and we want to be aware of signs of infection. So if we have increasing redness or increasing erythema, if we have increasing edema and swelling, if we have increasing pain, if we have any purulent discharge or pus coming out of the wound, then that is really concerning for an infection, and we want to visit our healthcare professional for management of that. But as I've said in this talk and in my wound healing videos, maintaining a moist environment will eliminate the scab formation, prevent scab formation, and create this optimal wound bed for proper healing. So let's get to the next myth. Myth number 5, that is antibiotic ointments are needed for optimal wound healing. Well, that myth is just not true. So antibiotic ointments, for example, neomycin, polymyxin B, bacitracin, these are a petroleum jelly ointment that is impregnated or includes an antibiotic. They have advantages and disadvantages. They can be good for some wounds, and they can actually be harmful. Well, what is the number one reason why antibiotic ointments can be harmful? Well, there's a few reasons, but the first is that they can lead to contact dermatitis. So there is approximately 10% of the population that is allergic to polymyxin B, and that is a very common antibiotic in antibiotic ointments. And so if you place that on and you're allergic, then you can get contact dermatitis, and that inflammation can impair wound healing and prolong wound healing. All right, so what are some of the advantages of antibiotic ointments? The idea behind an antibiotic ointment is that they will prevent infection in superficial wounds. So, for example, infection by bacteria such as Staphylococcus or Streptococcus, which is colonized all over our body. And when we have a disruption in our protective skin barrier by a scrape or a cut, then that Staphylococcus or Streptococcus and other bacteria, of course, can enter that wound bed and cause an infection. And so antibiotic ointments are aimed at preventing that infection. Well, when should you use an antibiotic, or when could you use an antibiotic ointment, and when should you avoid it? Now, before we get there, one thing I want to say is, as we've talked about, probably the most important advantage of an antibiotic ointment is the ointment part. So the petroleum jelly creates that moist wound environment. Okay, and so that's really the main advantage, much more than the antibiotic portion of an antibiotic ointment. Another disadvantage in antibiotic ointment is the growing risk of antibiotic resistance. So it may seem rather innocuous to use Neosporin or neomycin or polymyxin B, bacitracin onto a wound to get it to heal, but over time, we can develop antibiotic resistance in our communities by constantly exposing bacteria to antibiotics so that they can develop these mechanisms like methicillin-resistant Staphylococcus aureus. So one reason that we don't want to use antibiotic ointments generally on all wounds is that you can have contact dermatitis that can impair wound healing. Another one is the development of antibiotic resistance. So as I was alluding to, what are good candidates if you wanted to use an antibiotic ointment? Well, those would be minor cuts, minor scrapes with a higher risk of infection. So a scrape out at the playground, perhaps for that first day or two, we would want to use an antibiotic ointment. But in clean wounds, especially clean surgical wounds that have been closed in a sterile environment, there is no evidence that antibiotic ointments are helpful. If we have deep wounds or deep lacerations, antibiotic ointments can build up and form a barrier to wound healing. So in deep wounds, though, antibiotic ointments are also a bad idea. So finally, in my opinion, minor scrapes, minor abrasions, antibiotic ointments can be helpful in wounds that have a higher risk of infection. However, for the most part, just a simple moisturizing dressing with a petroleum jelly to keep that moist wound bed in an optimal healing environment is all that you need. But of course, contact your health professional for kind of official recommendations if you do have a wound that you're worried about. Let's get on to the next myth, and that's myth number 6. And myth number 6 is that scarring means poor healing. Well, that's just not true. So when we disrupt the epithelial barrier, there is a risk that we get a scar. And what is a scar? Well, when we go through the different phases of healing, the final phase, remodeling, and the third phase, when we are getting collagen deposition, when that collagen is laid down, that result is a scar. And they can be normal, and they can also be abnormal. So if we have hypertrophic scarring or even keloid scarring, where the collagen extends outside the wound bed, those are abnormal scars. But most of the time, when we disrupt that epithelial barrier, we are going to end up with a scar. Well, how do we minimize scar formation? And I'm going to take you through a few different types of wounds and how we can minimize scar formation. Well, why do scars form? Scars form from collagen laydown, and scarring can be worse if we have poor or delayed wound healing. Okay, so eschar formation, scabs, repeated trauma by pulling off a scab, those things are going to increase scar formation. We can also increase scar formation if we have too much tension over a wound. Okay, so let's go through a few different wounds and how can we decrease our chance of scarring. So first are superficial wounds. So minor cuts, abrasions, how can we help and prevent scar there? Well, first is just to create an optimal healing environment. Use a petroleum jelly, use a silicone-based foam dressing like a Mepilex or even a Band-Aid if it's very small. Those things are also going to decrease UV exposure to the wound, okay? And UV exposure can darken a wound and worsen the pigmentation of a scar, okay? Well, why does that happen? Well, melanocytes, those are cells in the skin that give skin its pigment, are attracted to wounds, most likely from TGF-beta, MSH, melanocyte stimulating hormone. These attract melanocytes to a wound and can lead to increased pigmentation. So if we can keep the wound covered with a moisturizing dressing, like some of the ones I mentioned before, and I put those in the description below, that can help optimize wound healing and decrease scar formation. Well, how about surgical wounds? So surgical wounds, we can decrease scar formation a couple of ways. Number one is by appropriate apposition of the wound edges. Okay, that's really up to the surgeon. Okay. Second is making sure that we have reduced tension across the wound. So in high tension wounds, I'll apply steri strips across the wound, which will take the tension off those opposed edges. Often, if I have to place sutures in wound, after I take sutures out, I'll place steri strips across the wound to decrease tension on that wound. Also, applying a silicone bandage or a hydrogel sheet, a transparent film dressing can help create a moist environment on that wound and decrease the risk of scar formation. During the remodeling phase, so that's going to be 6 weeks to a couple of years after a wound is healed, then of course gently massaging a wound can also decrease the risk of scar formation. Well, how about in burns? When we have superficial burns, first-degree burns, second-degree burns, those are the ones that are going to lead to blistering. When we have those, you want to listen to a healthcare professional, but silicone sheets, hydrogel dressings can create that moist environment to optimize wound healing and decrease the risk of scar formation. Another serious wound or laceration. So what is a laceration? Well, a cut and a scrape are basically confined to the epidermis and the dermis. But if we go through the dermis and down below that into the fatty layer, well, that is a laceration. And those usually require apposition with sutures or butterfly dressings or steri strips so we can get that wound after it's been cleaned, debrided, and we have a nice sterile environment, closing those edges so we can get proper healing. If we have a laceration that's left with opposed edges, then we have a risk of poor wound healing and significant scar formation. Another type of wound would be a puncture wound. So a puncture wound with a nail or something. It can be a deep but very narrow wound. Now the problem with those is you have an increased risk of infection. So it's very important to monitor for infection in these wounds. But again, a moist environment can help decrease scar formation. And then finally, are tension-prone wounds. So if you have a wound that's across the joint or in an area where there is not a lot of skin elasticity. So for example, on the medial anterior aspect of the lower leg, okay, across the shin bone. Well, those are high tension wounds and have an increased risk of scarring. So how do we decrease scarring? Well, we can surgically, maybe you do a Z-plasty. That could be more tension-free closure. But if we close the skin and pose the edges, again, steri strips across that wound can help take tension off those edges and lead to better healing. And as I mentioned before, after the wound is healed, some gentle scar massage can decrease the risk of that scar forming. And finally, let's get to that final myth, and that's myth number 7. Swimming with a wound is okay. Well, again, that's a myth, and swimming with a wound is not okay. And I'm going to give you the reasons that it's not okay, all right? So when we swim with a wound, whether that's in a swimming pool, whether we're in a river, whether we're in a lake, whether we're in the ocean, there are microorganisms and bacteria in swimming pools, specifically Pseudomonas aeruginosa and other bacteria that get into that wound bed and can cause inflammation and infection. In fact, there's a good study, I can put it in the description below, that swimming with an open wound is one of the major causes of wound infections. So whether it's freshwater, swimming pool, or the ocean, it's generally a bad idea. And we're not talking just about infection, but when we have an open wound and we go swimming, we can macerate that wound and we're going to impair all of the cells in that healing wound bed. There's a good study in the Journal of Wound Repair and Regeneration that those healing cells are disrupted both from the trauma associated with the wound and with the water damaging those healing cells. When we're talking about swimming pools, remember, swimming pools are going to have chlorine and bromine in them, which are disinfectants. Well, disinfectants are great when we want to get rid of bacteria in the pool, but remember, chlorine and bromine, it's going to kill not only bacteria, but healing cells, and that's going to disrupt the wound bed. It's certainly not doing you any favors to have chlorine in a healing wound. So it's generally recommended that we avoid swimming and submerging wounds until they're fully healed or covering them with a waterproof dressing. And a waterproof dressing could be like a hydrocolloid dressing or a silicone-based dressing or a transparent film dressing. These are some options for waterproof dressings to protect that wound. But certainly we do not want to submerge an open wound in a swimming pool, a lake, or a ocean. Now, sometimes, for example, with pilonidal disease, when I do a procedure where I excise that pilonidal disease and those pits and all the tracts and debride it, I will have a patient sit in a bath, a sitz bath, with some soapy water, and that's going to help debride the wound, keep it moist and clean. And that's really important when we want to facilitate wound healing in complex wounds. All right, so today we talked about 7 big myths with wound healing. We went through why we don't want to let wounds breathe. That's the big one. And we keep coming back to that. We don't want to dry a wound out and dehydrate it. Second, we talked about alcohol and hydrogen peroxide and how they can damage the wound bed in a number of ways, not only because they're disinfectants and going to kill the bacteria as well as the healing cells, but they also dehydrate the wound and cause increased oxidative stress. We talked about scabs and why we don't want scabs to form by maintaining a moist environment, back to number 1. And if we do have a scab, instead of picking it off and tearing it, we want to use a moisturizing dressing to create that optimal environment. We talked about antibiotic ointments, we talked about how to limit scarring, and of course, we talked about not submerging a wound in a swimming pool, a lake, an ocean, a river, or anywhere else you may want to cool off until that wound heals. So I hope you enjoyed that today. If you did enjoy it, I would direct you perhaps check out that video I made on the best dressings for wound healing. I go through wound healing and I go through, simple dressings and more complex ones. I even talk about our silver alginates and different collagen dressings that can improve complex wounds. Or you can check out my video on Wound Healing 101, and that's where I go through all these phases of wound healing, and I'll put those right up there so you can check it out. So if you like this video, make sure to give it a like, turn on the notifications so you're going to know when I put out these videos and you can be the first to watch them. Of course, if you can share it with your friends, that's going to show me that I am providing value to you. And like and subscribe to the channel. I'd love you to be a member of our community. If you have a question or comment, leave it below. I love engaging with you. And as always, stay safe, study hard. I'll see you next time.